Insomnia is a persistent disorder that can make it hard to fall asleep, hard to stay asleep, or even both. Many Americans turn to sleep drugs like Ambien for help, but are they the best option? Well, Dr. Ruth Gentry is a psychologist with integrated sleep and wellness. Thank you for being here.
Thank you.
So there are some studies that show sleep aid drugs can actually cause or be associated with other problems down the road, right?
Yeah, there's been, the last few years, been increased studies that show that long-term use of sleep aids, that is nightly and over years. So usually the sleep aids should be prescribed for short-term use, but people will often use them for years and years. And there's been research shows that there's an association with an increased risk for mortality, cancer, and even possibly dementia.
And even on older people who are using these drugs, there's other problems for them.
Yeah, and there's a concern with the older adults. As we age, we don't metabolize medications the same as a younger person. And so sleeping aids used chronically, nightly, could actually create falls or create higher fall risk, and also contribute to memory problems, confusion, and also kind of daytime effects the next day as well.
So you use something entirely different that's not even medicine based.
Yeah, no, I specialize in cognitive behavior therapy for insomnia. It's also called CBTI. And it's actually the recommended treatment for insomnia by the National Institute of Health and the American Academy of Sleep Medicine. People often don't know that. It's not medications, it's this treatment.
So what is it? How do you do it?
So CBTI is a brief treatment. It's usually done in a few sessions, and it's focusing on changing behaviors to help improve sleep quality, and also looking at way people are thinking about their sleep to improve sleep.
And is it effective? What are your results?
Yes, it's very effective. There's been plenty of research on CBTI, comparing it to Ambien, comparing it to Lesta, comparing it to various sleep aids, and long-term wise, it's more effective than sleep medication. So it's important to know that people do have options compared to medications. They can do this treatment, cognitive behavior therapy, insomnia, and often patients I've seen don't need medications anymore.
That's fantastic. All right, Dr. Gentry, we appreciate your help tonight. She will be here taking your calls until 6 o'clock. Just dial 858-2222.